happy that we are here together. Today, Merck Foundation is providing this health media training. I'm so happy that only because of the training, because also of the collaboration we are doing it with media, with art in the media and in Africa to capitalize on as a significant and important role we believe in strongly, that media and art and the soft power in general have a very important role in sensitizing the community and creating a cultural shift. Not only about fertility stigma, but also supporting girls' education, also addressing some topics like, for example, stopping child marriage, stopping gender-based violence, stopping female genital mutilation, raising awareness about STDs, about different health issues like diabetes, hypertension, because media enters every home. And can reach to everyone through media, either print, online, radio, of course, and television. And art, like music and songs and filmmaking and even fashion, can actually be contribution to that, because they are involved, or it's a part of the day-to-day setting of everyone. But I want also to emphasize that we had also stories. I can ask my team to share the presentation now, because I want to show the stories that we do. Is Rescue Jacqueline, and Rescue Jacqueline, or Jacqueline Rescue. It's about how we saved Jacqueline from child marriage. And this very nice story emphasizing in how she has the opportunity to get educated, to become a very important person in society, doctor or engineer or a school teacher, or something that is really adding value to her family, and to her future family. Next, please. The Ride into the Future. It's also about girls' education and how the bike that she is riding, and she got it from a friend of her family, helped her to continue her education until she became a very important doctor in the university. And this is also a hope, give hope to all girls, and give also solution that what they can do to continue education, and also give a message to women and mothers and fathers that don't stop with girls' education, because she has a potential she needs to reach and to fulfill her dream. It's very important. Next. Not Who You Are. It's another story that also will be tailored for Gambia with the names of Gambian names, local names. And this is about gender-based violence, and how emphasizing that men should, or husbands should, respect their wives. And this is also, of course, for children, and can be all for all the community, because it's a very great message about love and respect within a family, between a man and a woman, a man and his partner.
So what are the key take-home messages from my talk? Infertility is not a stigma. If someone is infertile, if someone cannot make someone pregnant, if someone cannot have a baby, okay, supporting your wife or supporting their wives. This is a very important thing that we need to mention here as a take-home message. We don't want this cultural practice to continue, because if it continues this way, it is very difficult for couples to reach their dream, or to attain their dream of having a family. Not always a woman is a problem. So if it is an issue of infertility, both men and women, they need to support each other. Both men and women need to support each other so that they can go for treatment, proper evaluation. And let's not forget that having a baby is not a problem of a man, or is not a problem of a woman. It's a shared responsibility. This is very important. It takes a man and a woman to have a child. It takes a tango it takes two to dance a tango. So it's very important to address this. Men are more than fathers, and women are more than mothers. Let's all remember this. As much as the couple is trying to have a baby, we cannot break the stigma around infertility in Africa if all these things are not addressed properly. So how will we break the stigma around infertility in Africa? This is very important. We have a very important hashtag here. Men too. Men too means men can be the cause of infertility. This is very important. Men can also suffer social pressure due to infertility. And you will see quite a big number of men who have been abused, for example, from the traditional healers, just because they cannot have kids. I've seen men who have been sodomized by traditional healers on the fact or on the reason that they are trying to sanctify them to have babies. So let's not forget that men too can suffer social pressure due to infertility. Men can suffer the infertility stigma, and men are more than fathers. This is very important. And how do we advocate for no to infertility stigma? This we need to achieve by creating a cultural shift in terms of what I've mentioned it earlier. This is for both men and women, but to break the stigma around infertility, we need to work together with the media, the clinicians, the health sector, whoever in one or another is involved. I think together we can create a cultural shift that can tackle infertility stigma in Africa.
Thank you. Thank you, Dr. Nicholas, for starting the ball rolling. I am going to talk about fertility management options and specific messages for the community. So how can we fight the stigma of women? Here I'm just emphasizing what Dr. Nicholas has already said. We need to educate everybody. We need to educate all levels, not sort of segregating that you just educate women because this affects women. We need to educate the men, we need to educate the policymakers, we need to educate the adults, the young people, women and girls. I was in class today with some of the medical students, and I was just we were talking about infertility. Actually, today's topic was infertility, and they were thinking like, this thing is not going to happen to me. And I was like, you girls, you are sexually active. Do you use condoms, for example? And they were just looking at me like, what is happening? And I was like, yeah, because you are having unsafe sex right now, you get sexually transmitted infections. And later on, when you get married, you are starting to look for babies and your tubes are already blocked. And you can only think back that, that time I should have done 1, 2, 3. But we need to educate everyone to take care of themselves in terms of prevention. We need to educate people on avoiding stigma because infertility can happen to men and women equally. Integration of women and men and girls should be done, but we cannot underscore the importance of the media, because media, you reach people everywhere, people listen to you. You can make a certain story in a way that people can really understand it and change their behaviors. We need to involve the civil society so that we can push this agenda even further, not to forget the role of the public authorities.
Thank you very much. Indeed, it has been an interesting summit so far and various presentations. So I'll go straight into the presentation. The first parts of my presentation are areas that have already been covered by the previous speakers, Dr. Nicholas and Dr. Belinda, so I won't spend much time on that. So maybe something that I would like to highlight is the fact that there's primary and secondary infertility, and that is for primary when the pregnancy has not been achieved for the first time, while secondary when someone has had a pregnancy before but they can't achieve it. Then also just to emphasize something that I think Dr. Nicholas has all touched on was that prevention, diagnosis and treatment of infertility are important towards the management of infertility. They include the various aspects that cover fertility care. What role do you have to play actually in this journey? I think the media team are very cardinal, because when we look at infertility, child marriages, female genital mutilation, we appreciate that there's a lot of social cultural context to this presentation. And that's why you, the media, come in very handy, because you are aware, you'll be a key platform to create awareness about this condition, to educate the public, guide on services available, I think Dr. Nicholas and Dr. Belinda also touched on the importance of awareness and education, and even the services that Dr. Belinda was referring to. So there's a large part of the African population that is not even aware that such services are actually available. You find they'll be going to traditional healers and all these other aspects, and there's actually medical assistance available for them. Then there's also the role of advocacy. You can advocate to the different governments, civil society organizations, to create platforms where these women can actually and men can actually seek assistance. Lobbying for changes in health policies. Are these things that can be looked at in every level, at community level, primary health care, instead of just waiting till someone is referred through the channel, which the proper system or channel that would take a while before they get the help that they need? So these are some things that the media could actually play a major role in.
So how can we really use mass media to successfully convey the messages that we have into the community? So we should know that media is a very powerful tool. And if you really want to reach a lot of people in a very short time using a very small amount of money, then media is a perfect place for us. So really, mass media should be incorporated in whatever prevention program that we have, either for communicable diseases or non-communicable diseases. But the key important issue is that people need to have the right messages. So there's a lot of time, next slide please. There's a lot of time that we have witnessed a lot of media conveying misconceptions about diseases, and this can really be misleading for the community. So the important issue here is to educate the media personnel on how the disease is, so that they can also convey the right messages to the community. Because what people hear, it's easy for them to believe rather than a clinician who is always at the hospital. So the issue here, we also see that there is low health illiteracy. So not so many people in the media maybe will bother to read about things in detail. They'll also just read the headlines. So if we don't analyze different type of information in the correct manner, then it is difficult to really convey the right message to the community. But also, we have alteration of messages. So you have maybe a clinician interviewed here, and maybe they'll speak a certain message, but what is conveyed to the community will be different, either because maybe it wasn't really understood, or maybe it's against the cultural norms. So the media can also lead to alteration in some messages, and this can be a problem within our community. So generally, when we use the mass media in the appropriate way, we can really convey the best messages to the community and have the best impact that we have never seen. But the opposite is also true, that media can also have a very a negative effect if not used appropriately. So I would like to thank, of course, the Merck Foundation for the opportunity to speak, but also the Ministry of Health, because I am employed in the National Institute for Medical Research. And also I'd like to thank all the people for joining in. And that's the end of my presentation.
Make sure you do some simple research concerning the issue. Sometimes I can go to sit with some youth asking, maybe we've heard some smoking can relate to infertility. So I can ask them, why are these young people still smoking, and even more than the others? So I get some facts from them, some information from them, and go back to the specialist, this expert, to find the facts that concern the problem, so that to let the story to be a very positive impact, to make sure that they get this education. Before you go to the interview, make sure you prepare some your question to be asked there. Best way another is to give your story a time review before the publishing. Make sure you give the story time that you can write it and start and repeating reading, because sometimes if you will be not aware, your story can also be can be taught, as one of the doctors said, that media also can lead to misunderstanding. So make sure you give the time to your story before publishing it. And you may use social media to engage with your audience to get the feedback. So we are the voice of the voiceless, they said, because we've a very big number of audience which are listening to our radios, which are following our stories, they are our leaders. We need to give them fact information. We need to speak for them to make sure that they got this fact, they change their mindset and create awareness. Asante sana. Thank you.
Why do we write for change? Media has changed, but journalism remains. The media has evolved rapidly in the last decade with the innovation of e-platforms. The platforms have simplified communication for everyone. In simple terms, media implies that main means of mass communication: television, radio, newspaper, and internet. What we see in the internet, there are citizen journalists who contribute to the journalism, but also the journalism remains. Journalism, on the other hand, means that the profession of writing for newspaper or magazine or broadcasting news on radio or television or else on the digital, on the e-platforms. Internet has changed the face of media. The platforms have evolved from analog to internet-based, but this does not change journalism as profession. Feature articles are still needed. When I say media has changed, but journalism remains, in journalism, you have to raise awareness. Educate a girl and she can change the world.